welcome back. Time for our weekly medical checkup. We're taking a look at how many women might be dealing with early signs of menopause without even knowing it.
Yeah, plus we're going to talk about new research that suggests that too many protein supplements could be impacting the mental health of young men.
NBC News medical contributor Dr. Vin Gupta joins us to discuss some of these health headlines. Dr. Gupta, good to have you with us. Let's start with this study. It's the University of Virginia Health System finding many women don't realize they're experiencing symptoms of perimenopause. So talk about what that is and what the symptoms are.
Yeah, Joe, good morning. This is the time between the onset of menopause, and usually can happen as early as age 30 to 35. It goes often diagnosed because we don't really talk about it, but it's the set of symptoms: fatigue, irritability, just an inability, myalgias, a predisposition to migraines that can afflict younger women. And frankly, they just don't talk about it and they don't get treatment. Potentially hormonal treatment is something that they could consider. So in terms of doctor's orders here, don't suffer in silence. Make an appointment with your primary care doctor and then share these symptoms because there is potentially treatment.
Interesting. Okay, now let's look at a study that found that the Mediterranean diet, we hear so much about this diet, it may lower your risk of developing some types of cancers. What types of cancers are there? And remind us what this diet is and why it's so good.
Yeah, well, so yet another study here, Savannah, on the Mediterranean diet. What the study found was that there is a benefit to reducing cervical, prostate, colorectal cancer across the board. For women, it was any type of cancer. There was a reduction if they followed a Mediterranean diet for at least a year. And this is really regardless, Savannah, of body mass index, of weight. And so it really, if you adhere to this diet, there's benefits to heart health, but also to cancer risk reduction here for both men and women. And so, it remains to be true. A plant-based diet, doctor's orders, is the way to go, and red meat as a treat, that's really the way to be thinking about it.
Yeah, and I was just listening to something today that says, it's so important to get a variety of plants and remembering that those can be, beans, different types of greens, different types of fruits. As long as you're getting in that variety every single day, it can make such a huge difference in your health. All right, before we go, let's talk about young men overusing muscle building supplements and whether that could be a sign of body image issues. A new study suggests it might be. What can you tell us about that?
Yeah, Joe, this study looked at basically young boys and young men, sort of that late teen into early adulthood, that group, and that there was a predisposition to body dysmorphia, really focused, and they use the term obsessed with body muscle tone, muscle mass, and they tended to use at least one or more forms of protein supplementation. And unfortunately, this was linked to body dysmorphia, just this obsession. And so really the focus here should be set realistic goals, don't overdo it with supplements, really no more than one supplement. And really my concern here as a doc here is overuse of things like testosterone off-label, which can be linked to some serious side effects. So that's really the concern here.
All right, Dr. Vin Gupta, thank you so much. Appreciate it.
Important info, thank you. Well, now let's talk